Earlier this month, I had my second opportunity to give a low vision lecture to the ophthalmology and optometry residents at the University of Virginia. It was an opportunity for me to help those young doctors better understand the impact that impaired vision from macular degeneration or some other condition has on a person's life. This is the first time that I've given a lecture totally by computer. It's not quite as satisfying as being in the room with your audience where you can see how they're reacting to what you're saying. One of the things that I tried to make clear was the patient's desire that at every visit they want us to do our best to help them see the very best that they're capable of. Monitoring and treating are important, but the patient wants to be able to see. Also, it's important to know exactly how the low vision problem is affecting the patient. So I asked them. And in part of this lecture, I discussed a patient who'd been referred to me, a nice 76-year-old lady. There were a number of interesting things about the report that I received from her doctor and what I recommended for her that I thought would be helpful to the young optometrist and ophthalmologist who I was speaking to. Sometimes the solution to someone's problem can be very simple and straightforward, such as these large print checks that I recommended, and also writing with a Sharpie pen that gives a bold mark. I showed a video of several of my patients who discussed how they were doing and how their lives had been impacted by the bioptic glasses that I prescribed for them. These two lectures that I've given to the residents at the University of Virginia have been interesting to me, and I hope that they've been helpful to those young doctors. I'm hoping that as a result of what I've shared with them, they'll have a better understanding of how difficult impaired vision can make a person's life. And also, I've shown them some ways that they may be able to help their patients who are dealing with low vision